Supporting our circle, the National Tribal Clearinghouse on Sexual Assault provides resources and education to service providers to improve responses to sexual assault and empower tribal communities. This video will explain the role of a sexual assault nurse examiner. Sexual assault nurse examiners, otherwise known as a SANE, is a type of forensic nurse that provides care to sexual assault victims. A SANE is a registered nurse that has specialized training to conduct a medical forensic exam, or, as it is otherwise known, a SANE exam. During this exam, the SANE nurse provides medical care, collects evidence, and provides expert testimony should your case go to trial. The SANE exam is a medical examination performed for the purpose of providing trauma-informed care that includes an examination, preventative STI medication, and evidence collection. A SANE's number one goal is to provide a patient-centered, holistic approach and to prioritize both the physical and emotional well-being of the survivor. SANEs also care for a variety of patients who have experienced assaults and trauma in addition to sexual assault, such as strangulation, sometimes referred to as choking, domestic violence, and other instances of abuse like child abuse, elder abuse, and sex trafficking. Not all hospitals and clinics have SANE nurses on staff that are able to perform a SANE exam. However, the local rape crisis center can provide the name and address of the nearest facilities conducting these exams. They can also provide the contact information of nearby victim advocacy programs who may be able to provide support, resources, and transportation to and from the medical center. It is also important to note that victims do not have to file a police report or report the crime to receive any part of the sexual assault examination. Even without evidence collection, a victim can still get STI medication, emergency contraception, or even a quick physical exam to make sure that they are healthy. The SANE exam provides victims the opportunity to have the evidence safely preserved and stored should they decide to report the assault to law enforcement at a later time. The SANE nurse can provide additional information as to where the forensic evidence is sent, how it is stored, and for how long it is stored. The amount of time forensic evidence is stored varies by jurisdiction. Some jurisdictions will automatically test the kit for DNA markers, whereas other jurisdictions hold the kit until a survivor authorizes permission to test. Federal law states that survivors have the right to a SANE exam at no cost. In fact, most states and territories have laws or policies to provide for access to free exams for sexual assault survivors. Exam costs for American Indian and Alaska Native individuals who are citizens or descendants of federally recognized tribal nations are covered by Indian Health Services, investigating law enforcement agencies, healthcare providers, or designated state and county payers, depending upon who and where the examination is conducted. Victims should not be charged for the exam, should not receive a bill for the exam, nor should the cost of the exam be billed to any health insurance provider, if available. What to expect during a SANE exam. SANE nurses offer a compassionate and non-judgmental environment where survivors can feel safe. This is especially important since many survivors may feel extremely uncertain about how a SANE exam works. The SANE nurse will explain the process and inform the survivor of what to expect before, during, and after the exam. All parts of the SANE exam are the victim's choice. A victim has the right to say no to any part of the exam that makes them feel uncomfortable, or to stop the exam at any time. A victim may request a victim advocate be present during the exam. The victim advocate, if in the room with the victim during the SANE exam, is there to support them and should not assist the SANE nurse with any part of the examination. This includes holding medical equipment, supplies, or providing interpretation services. If law enforcement is present, they are not allowed in the exam room during the exam. The SANE will ask the victim what happened during the assault to determine how the physical assessment will proceed, to determine how they can provide the appropriate medical care, and what type of evidence is appropriate to be collected. SANEs prioritize the needs of the patient. this includes getting consent from the survivor for every part of the exam, including physical assessments, photographs, and evidence collection. Consent is especially important to help survivors feel comfortable and to regain a sense of control that may have been lost during the assault. Some of the documentation during the exam may include taking photos, type of evidence collected, toxicology information, documentation of injuries on a body map diagram, and victim's description of the assault. Importance of SANEs in sexual assault response. SANE nurses are a critical partner in enhancing the community response to sexual assault. They empower survivors by providing them with information, options, and support throughout the entire examination process, and they advocate for survivors' rights and autonomy. SANE nurses play a crucial role in collecting forensic evidence, which can strengthen legal cases and assist in bringing the sexual offender to justice. They also provide medical evaluations, treatment, and referrals, which is impactful in reducing the risk of long-term physical and psychological consequences. For more information about the role of a sexual assault nurse examiner or other videos relating to enhancing the response to sexual assault, we encourage you to view our resources in the NTCSA Learning Center.